Well, good afternoon. I'm Valerie Hillo Gates, Executive Director of the American Heart Association here in Greater Cleveland, and we're so excited to welcome you to our virtual roundtable today. Throughout the pandemic, the American Heart Association has been committed to meeting people where they are, and we have provided a series of free educational discussions with a wide range of health topics, including today. We are focused today on health equity in the workplace, which is central to the mission of the American Heart Association. So all of our work is really dedicated to the achievement of our 2024 impact goals. We believe that every person deserves the opportunity for a full and healthy life. As champions for health equity by the year 2024, the association will advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality. So that's where we will spend a bunch of our time today. So a few logistics as we head into today's webinar. All of our participant attendee mics and cameras are muted and will remain so during the presentation, so you may actively listen and follow along. But we do invite you to participate by using the chat box function, and you can enter in any questions that you may have throughout the presentation. There will be some time allotted where we will get to those questions from the chat box. We also will provide a PDF of the slides, and we also will be recording today's conversation. So let's get to our featured panelists. It is my pleasure to introduce both Dr. Kelley Hancock, who is the president of our Cleveland Board of Directors here at the American Heart Association. Kelley serves as Chief Caregiver Officer for Cleveland Clinic. In her role, she's responsible for leading the development and implementation of all aspects of caregiver engagement for Cleveland Clinic's 70,000 caregivers enterprise-wide. So this topic is near and dear to her heart. After Kelley, we will be hearing from Gerald Johnson. Gerald serves as Executive Vice President of Health Equity and Chief Diversity Officer for the American Heart Association nationally. He came to the American Heart Association over a decade ago with a wealth of experience in building brands and driving sales results for a plethora of well-known brands, and we're so glad that he's here leading our efforts. So I'm going to turn it over to Kelley.
Well, thank you, Valerie, and welcome, everyone. We so appreciate you joining us today to discuss such an important topic. As we know, everyone deserves an optimal and just opportunity to be healthy. And I think giving special attention to the needs of those at greatest risk of poor health is really why we're all here today. And as champions for health equity, the American Heart Association is working towards a future where no one is disadvantaged from achieving their potential because of either social position or any other socially defined circumstance. You'll see what we call the science journey, which outlines some of the key focus areas of the association since its founding in 1924. And when we started truly looking at the social determinants of health at the AHA about 7 years ago, and how that really evolved into fighting structural racism, as well as really increasing rural health 2 years ago. Inequity, discrimination, and bias really have no place in the workplace, but yet they remain. And these problems have proven to be a heavy toll on the health and well-being of employees and organizations, particularly during the pandemic. And this is really important to me in the work that I do in our organization. And I know it's important to each of you, as evidenced by you taking the time to join us today. This slide identifies some of the key barriers to health equity. The American Heart Association is committed to advancing health equity, which can only exist when people have the opportunity to enjoy healthier lives. As company leaders, I know we are all here today because we're committed to ensuring that no employees are left behind and that they all have a chance for a healthy future. Addressing health equity includes understanding what are the social determinants of health. And again, these are conditions in which people are born and they live, including income, jobs, access to affordable, nutritious food, and quality health care. Social determinants of health, along with structural racism and rural health disparities, are really all examples of things that can play a role in standing in the way of achieving health equity. Identifying and eliminating workplace practices that lead to inequities can improve the health of employees and communities. And as we reckon with structural inequities throughout society and really understand their disproportionate impact on health of the employees, business leaders across the nation are examining their own policies, their own procedures and programs. And it is our hope today that we can share some examples of things happening not only nationally, but really right here in Cleveland, and really start to begin to foster that dialogue. So in support of the impact goal that Val shared, there are also 10 commitments that were created to support efforts around bringing the goal to life. Workplace Roadmap is the 7th commitment, and really where today's dialogue fits in. Some of the questions we want to address with you today include what health equity in the workplace really means. Why is it important to your employees' well-being? How to identify and really eliminate those barriers to good health in the workplace? And how to make your workplace one that really supports and encourages equitable health and well-being for all. And we hope you find the time together meaningful and that you'll participate with ideas and questions in the chat box. And we look forward to that robust dialogue. And so with that, I'll turn it over to my colleague, Gerald.
Hey, Kelley, thank you. And hello, everyone. Kelley, that was a great overview, and I'm happy to share a little bit more about how we're addressing these challenges. I'd like to start by acknowledging the American Heart Association CEO Roundtable, which is a leadership collaborative made up of about 50 CEOs from the nation's leading employers, which is an impressive group when you think about the Fortune 500 companies. And this is an unprecedented leadership collaborative dedicated to improving employee and community health and well-being through evidence-based solutions. And this group shares and scales what it learns throughout the AHA and calls upon business leaders everywhere to join us in this commitment to improving employee health and well-being. What's interesting about this group is that throughout the member CEOs, we were able to shine a light on this idea of health equity with work we released last summer called Driving Health Equity in the Workplace. And that included a series of guiding principles and actionable strategies to help any organization, regardless of size, address health equity. And the beauty of this is that the Roundtable helped generate ideas, best practices, and resources that are now available to all companies. And I think in a little while, we're going to make it available to all of you. We're going to drop that in the chat box, and so that everyone can have access at no cost. The interesting thing about this is that when you think about tools and resources, we know that unless it's easy to use and easy to share and easy to navigate, it's going to be hard for others to really leverage this great work. So these are the available resources. I think it's been made available to you in the chat. And so we hope that you will find this work as exciting as we do. You may be wondering, how did we arrive at this report? And I'm happy to say it was a result of one of the bold goals that the American Heart Association set out around a roadmap for employers to really think about eliminating policies and practices that contribute to health inequities. Said a different way, with the help of expert leaders and the CEO Roundtable, we formed a writing group that really helped to inform the AHA on this project, and more importantly, the shared experiences from other companies. I'm also delighted to say that Quest Diagnostics, located in Cleveland, is launching a story this month, which we're proud to feature on our website and hope you all will get a chance to read when it posts. And then what I'd like to do is bring up the next slide and just talk a little bit more around the work. And if you think about any good work, it starts with surveys and who you talk about. We had the pleasure of surveying more than 1,200 adults in organizations and found that there were significant variances in how people thought about health equity and how they thought about things from a race perspective, ethnicity perspective, and other demographic groups. And while many respondents felt the effects of the health inequities, most respondents felt that the workplace was a positive place where they felt like they could bring their whole selves, which we think was pretty good. Next slide, please. What we also noticed was that there were noticeable differences. Maybe could we go back a slide? I'm sorry. What we noticed was that there were noticeable differences between different groups around how important health equity in the workplace was. Different respondents whether they were white colleagues or Black or Asian or Hispanics, all saw this somewhat differently, suggesting an opportunity for us to really review and really improve, collectively what we call our organizational practices. And then also think about things like allyship and other ways that we can increase understanding of the different challenges that different folks face. Equally important is that we realize that while the perception of health equity significantly varied by race and ethnicity, 66% of people of color responded that they thought that the practices negatively affected their health and well-being and was a big deal, compared to 38% of folks that were non-diverse. Point being, there are different points of views on how important this work is, and we recognize that in order to make it better, continuing to get input is going to be important. And we also know that when you look at all the different inputs that we got, it boiled down to three important areas, right? One is being reduced to being talked down to. Another area was being reduced to my identity, which is what I look like. And then there's the feeling of that DE&I efforts are just generic. So as you think about your companies, you think about your work, think about those headlines. They may be important when you think about where you may want to decide to go next. So next slide, please. When you look at some of the respondents, you can see, as I mentioned, being talked down to, you can see being reduced to identity, you can see these things. And I think equally important, there was the perception of younger workers was also noticeable. The younger you were in the workplace, we also noticed that they had a stronger belief that workplace equity and all these issues were more noticeable than it might have been to colleagues that were older in their careers. You bring up the next slide, please. When you think about structural racism, we talked about age. The thing that's also important when you think about this is how often you are thinking about health equity in your organizations, when you think about your younger colleagues, when you're thinking about the things that you'd like to get input from them on. Think about the fact that 82% of respondents overall felt comfortable bringing their whole selves to work, while many people said that in doing that, there were different challenges that they had faced. Next slide, please. I think equally important across all respondents, the benefit that we provide, that they're least likely, like commuter benefits, childcare, banking and financial services, all of these things are things that would mean a lot to really help address health equity and the social determinants of health and some of the concerns that folks have. So as you look at this slide, while there might not be a lot of optimism, there are some things that could be done that could really help people feel better and learn the things that would help them address these issues that we're talking about today. And then I think that the last thing I want to say is, if you go to the next slide, I want to talk about the importance of allyship. And here, what we're learning is that allyship is important to all. How it shows up might be different, but what it really means, if you boil it down, it means advocating to advance the interests of people of different races or ethnicities or genders or sexual orientations and abilities. And interestingly, people of color were more likely to respond positively if they had colleagues that spoke up on their behalf. And I know that there's a lot to digest here. This data is eye-opening, but I want you to know that all of this data influenced some of the work that you're going to see next. And what I'd like to do is go to the next slide and talk about some of the things that you could do in your organizations if you're wondering where to get started and how comprehensive this work is. And so there are 15 actionable strategies in total. This slide shows the first 8. A couple of them include looking at your hiring and retention and recruitment practices. It includes asking hard questions around what kind of equity is in your employers and managers and leadership. Thinking about healthcare coverage, how comprehensible, how understandable is it? How affordable is it? I think many of us know people that actually have health benefits, but many of them don't use them because many of them can't afford the copays. So when you think about making sure that you provide healthcare that's commendable. But if it's not comprehensive, and if it's not understandable, and more importantly, if it's not affordable, you may not be helping all of your employees. The next slide shows a couple of additional examples. And again, I won't clear the chart here, but it talks about looking at things like pay equity. When you look at your organization, where do you sit and do your employees sit on the pay equity scale? Also looking at the fact that making sure your employees have a voice. You know, there's one thing to say that leaders drive companies, and to many extents that's true, but often great companies are companies that also leverage the voices of their employees. And so what are you doing to make sure that your employees have a voice in organizational decision-making? And maybe the last one I'll think about here is really thinking about how your organization communicates and how culturally appropriate, how diverse representation is being done, and how accessible are all the tools that you are creating. And I think it's safe to say, I think we all know this, but putting it into practice is something different. One size does not fit all. And so if you're communicating in one way, if you're doing things differently, you may find that you're missing the opportunity to engage many of your employees. Next slide, please. And then, you know, in addition to the 15 internal strategies, and again, the importance here is this is not a mandate for you to do all of them. What we are saying is that based on what we've learned, based on the examples that we've gotten from all the companies that have contributed examples, you may ask yourself, where are you on this continuum? And so those 15 things are things that you can look at. We also thought about the external opportunities, because as you know, being a good steward to your employees also means thinking about the communities in which they live. And so there are 5 actionable strategies that you could also employ that could really make a difference for the people that work in your companies. And again, examples are inclusive of advocating for comprehensive and understandable healthcare, as I mentioned earlier. If you think about affordable housing, you know, in many cities across the country, and maybe in a city where you live, you know, affordable housing is a thing. And so that means if it's a thing in your city, it's a thing for some of the employees that are part of your organization. And so you may want to think about, what are you doing to advocate for affordable housing? And then I think the other big thing that we find is continuing to make sure that you're thinking about affordable and early care and education for children. Because one of the things that employees care about are their families. And all communities are only going to be as good as the schools and the education and the early education that's provided. And so these are, again, some actionable strategies that are externally facing that really give you some additional ideas of how the workplace equity resource can be used by you and your organization, regardless of the size of your organization and regardless of where you are in your journey. Our hope is that anything free can be used. Our hope that anything that reflects the thinking of some of the brightest science, business leaders, and community leaders will be a resource to you to help you and your organization think about improving your journey from a workplace equity perspective. So I'll turn it back over to Valerie now to keep our conversation going, and look forward to engaging you throughout this conversation.
Thank you so much, Gerald. And thank you, Kelley, also that went before Gerald. So we're excited to continue the conversation, and we're going to be hearing from several other Cleveland area business leaders. And we're going to show a quick video now of who our esteemed panelists will include. Great. And a quick reminder that if you have questions, as you hear the various panelists answering some of these questions that we received in advance, you're more than welcome to put those in the chat box and we'll get to those. So we are going to start with Mouris Saghir, who leads the National Cardiometabolic Center of Excellence for Quest Diagnostics at Cleveland Heart Lab, which is located here in Midtown Cleveland. Quest Diagnostics empowers people to take action to improve health outcomes throughout diagnostic insights. And Quest is one of the largest lab companies in the world. They annually serve 1 in 3 adult Americans and half the physicians and hospitals in the United States. So we're going to start with you, Mouris. Can you share a bit about how Quest Diagnostics has embraced health equity for all?
Yeah, sure. So thank you, Val. So I moved to Cleveland about 2 years ago from the New York area to take this position that Val mentioned. So the Quest Cleveland Heart Lab offices are in Midtown. So if you want to visit our lab, take a lab tour, drop me a line. So back to answering Val's question. So what are we doing around embracing health equity? See, in 2020, Quest launched the Quest for Health Equity program. It's a $100 million multi-year initiative focused really on addressing inequities in healthcare that impacts the under-resourced population across the US. The initiative includes providing donated testing, education programs, partnerships, and funding. Since launching the Quest for Health Equity, we actually have built partnerships with community-based organizations, national non-for-profit, faith-based organizations, academic institutions, and healthcare leaders. For example, externally, we've joined forces with the American Heart Association at a national and local level to support scholarship for historic Black colleges and universities, the HBCUs, and Hispanic serving universities, pursuing healthcare careers. These students, as you know, the participation of these Black American and Hispanic American students in the sciences is much lower than the national average. So we are doing our bit to encourage more participation. Through this grant, the AHA is also providing funding for COVID-19 relief and hypertension management program across the country. As you know, AHA is very focused this year on these two main initiatives. Internally, the Quest for Health Equity has helped launch several HR initiatives for employees, including training modules on topics like unconscious bias in the workplace, incorporating a diversity day, creating a company-wide diversity calendar, and other training and initiatives for leaders. We've had a robust assortment of actually employee business networks, or what we call EBNs, that are very active within the company. These networks include African-American, Hispanic, Latino, Pan-Asian business leaders, women in leadership, pride, veterans, diverse abilities, caregiver groups. These EBNs promote educational opportunities for members and for all Quest employees around prevalent topics impacting their respective areas of interest.
Great. Well, thank you, Mouris. Earlier we also heard about some of the actionable tips that are coming out of the Health Equity in the Workplace report that were centered around HR practices. Could you speak to some of the things that your company has done in the HR space to ensure equity from a leadership perspective?
Yeah, sure. Yeah, so I mentioned a few, and I love the list actually that Gerald went through, right? The internal and external actionable strategies. Those were fantastic. And we actually go through a lot of these items at Quest. So in addition to what I mentioned earlier, we part of this Quest for Health Equity, we've invested in internal leadership structure around Quest for Health Equity. So we now have that team led by a vice president focusing specifically on improving equity at Quest, which has had actually great results already. As executive leaders in our company, we also are actually held responsible for how we're advancing diversity and inclusion within our teams as part of our 2022 performance review process. So we take it very seriously. In hiring, as again Gerald mentioned, we are focusing on not only diverse candidate pool as we hire for open positions, but also on having diverse hiring managers and staff members conducting the interviews to ensure we're not bringing unconscious bias to interviews themselves.
That's so important. So great to hear, Mouris. Thank you. And lastly, could you just maybe give one example of something that you're undertaking in the community to help with health equity?
Sure. I'll give you 2 examples. Is that okay? One actually is around how patients at risk of chronic kidney disease were identified in testing. We are in the process of actually changing the calculation used for a test called estimated glomerular filtration rate, EGFR, that measures kidney function. The new change removes the race-based coefficient found in the prior calculation. The race-specific reporting of kidney function is now believed to have underestimated chronic kidney disease risk in the African American patient community. Another effort involves free comprehensive diagnostic assessment for all employees that allow them to identify if they have any underlying issues that could eventually lead to cardiovascular and metabolic health diseases. The results of these free comprehensive diagnostic assessments really equip our employees not only with information they will need, but also for them to be paired with health coaches if needed to empower them to gain greater control. All of this, of course, benefits all employees, but also impact many of our African American employees.
Okay, great, thank you. We are going to move in our panel over to Celina Cunanan. I'm so excited to introduce. She is the Executive Director for the Office of Community Impact, Equity, Diversity, and Inclusion at University Hospitals. This is in addition to her role as the System Chief for Nurse Midwifery. So Celina, welcome, and can you comment on why health equity in the workplace is so important to university hospitals, both as a large employer and a large healthcare system locally?
Oh, thank you so much, and for the very kind and warm welcome. And I'm thrilled to be here and join this esteemed panel. I've come into the diversity space as an expert in maternal child health. And that really, I've been with university hospitals for about 20 years and looking as a midwife and caring for patients within the community. And not really realizing until I was here for 7 years that there was a lot of disparities that existed. And that kind of started me on my path to search out why. And it was for many of the reasons that Gerald so eloquently stated at the beginning of this talk. Systemic racism, issues of systems of oppression. And so as an organization and the second largest employer in the area, University Hospitals, we look at ourselves as leaders. We look at ourselves as providers of healthcare of our communities that we service near and around our downtown location and throughout the region. We really look at ourselves as our hometown team. And we know that we have a responsibility to not only improve the health of the people that we service, but that starts right here at home within our walls. And so equity, providing places of equity within the organization is certainly important. We have to walk the walk, and if we're going to talk the talk. And so, we're working on a lot of things internally to look at how we provide equity along our journey to make sure that our places within UH are places of belonging and inclusion for our caregivers. We circle all of our programming around our core values at UH, which is service excellence, integrity, trust, compassion, and most importantly, belonging. And so how do we, like Gerald so said this morning, how do we bring our true authentic selves to work? And how do we make sure that that people feel like they can be their true authentic selves in UH as an employee of UH? So it's we're very focused on that right now, and we're certainly on a journey to seeing what we can do even more to help improve that.
That's great. Thank you for sharing. And, you mentioned, obviously, University Hospitals has a very large workforce here across Northeast Ohio. Could you give some ideas maybe to someone on the call with a smaller workforce on maybe how they could get started? Were there any things that you've done at UH that maybe could be scalable or a place to start?
And that's so funny that you asked that because, the focus of my office previously was really just on the clinical faculty excellence and diversity. And over the course of the pandemic, as we've seen, we've kind of pushed out all of our programming throughout the entire region. So I would tell people in the smaller institutions, it doesn't matter how small, every effort is important. Our bias training program, which we utilize Cook-Ross, grew out of a grant that we utilized through First Year Cleveland, of which UH was the fiscal agent for the county, and we trained trainers here. That training we have pushed out to our entire organization, and we're working on ways to make sure that we develop a cultural humility curriculum that all of our employers and caregivers can take. We want to make sure that they honor our patients when they come in through our four walls, wherever that might be. So those are, kind of smaller things that you can do that grew from a small program that we just were focusing on OBGYN to something that was larger for the entire system. So that's one way of doing it. I think the other way to see is to kind of find the people within the organization that are also vested in it. I mean, I think so often when we're as diversity leaders, it's often sometimes lonely work. As I'm sure many DEI leaders on this call can attest to, it's important to find the people and the champions within the organization that are just as focused on it as you are. An example of that is, clinically, we've developed an equity officer council in which we're developing equity officers for all of our clinical departments. Well, we're just starting with our clinical departments. Doesn't mean that that's not what we're going to do in all of our departments throughout the organization. So it's an exciting prospect and for them to serve as an advisory to our office, in which we then advise our leadership on issues that are important to us as diverse caregivers within the organization, and making recommendations on how the organization should respond to things or be proactive in the space.
Great. Well, thank you so much for that. We're going to come back over to Kelley Hancock now, and another large employer. Can you help us think about, some of the ways Cleveland Clinic has been focused on employee health, and maybe in light of some of the things we've heard already on this call?
Sure, and thank you for the question. I think specific to the topic at hand today, I think it's important to know that at the time we had the social unrest across the country and here in the city of Cleveland, at the time, the Cleveland Clinic publicly supported Cleveland City Council in its declaration that racism is a public health crisis in our communities. And since that time, our healthcare system has worked to really try to reaffirm our commitment to diversity and inclusion through new programs and partnerships. One of the programs that we put in place at the time and continue today is listening sessions to really understand what our caregivers were feeling, what other support they needed, so they really could come to work and be their true best self. And as a result of that, we have a longstanding history of employee resource groups. I'm sure many of you do as well. But recently, because of those listening sessions and the feedback, we went through a renaming process for some of those groups to better reflect those feelings of our caregivers based on that feedback. So one example is our Black Heritage ERG, Employee Resource Group, which really provides a network that supports the professional development of our Black caregivers at all levels in the organization. And we work with the leaders and the local managers to really advance the inclusion, the retention, and really the career mobility of Black talent in our organization. We've also had an extensive LGBTQ+ employee support system in place for a number of years, with tremendous work that has been done to support our patients and our caregivers. And that includes calling that employee resource group Clinic Pride. And we subsequently have the policies that support our inclusion-driven culture as a result of the work that this strong team has done to help promote that health equity that we're talking about today across our entire enterprise.
Thank you for sharing that. As we think about how the world has changed these last 2 years during the pandemic, we know arguably healthcare was probably one of the most challenging places to work during the pandemic. So could you speak a little bit about how you supported employees or caregivers during the pandemic itself?
Sure, absolutely. So first, I think, I'd be remiss if I didn't mention how proud we are of all of our caregivers across the organization and the compassionate care that they continue to deliver, not only at the height of the pandemics, the up and down of the surges, but what they continue today. So in terms of their support during really those height of those surges or those pandemic levels, it became even more critical than ever for us to support the caregivers and their families. One of the things that we put in place is that we established a caregiver hardship fund that generated nearly $4 million for about 3,000 caregivers who were impacted by the pandemic with unexpected serious financial issues. And we know we wanted to support them and their families. We also launched an online community called Connecting Caregivers. And this online community has resource information and discounts in terms of what people are experiencing during the pandemic. So issues with childcare and connecting them to the right resources, elder care, even pet care. We also had opportunities to provide virtual learning, tutoring for children. We had food delivery, healthcare. We had a variety, just like many of my colleagues on the phone, of well-being and resilient resources as well. And we also formed a caregiver support team. And as we've been monitoring the number of caregivers who are out with COVID-19, obviously that, aligned with what we were seeing at the community at the time. And so we had a system in place because of the support team. And one of the things that they put into place is that they delivered over 75,000 meals in 2020 through a variety of different community partners in our communities. And that included meals for our caregivers, meals for their families. We were able to assist with getting their medications to their home, again, assisting with childcare and pet care where appropriate. And we know from hearing from our caregivers that it went a long way in supporting them during this difficult time.
That's really admirable. Thank you for sharing that. Next on our panel, we're going to hear from Dr. Blanton Tolbert. He is the Vice Dean of Diversity and Inclusion for Case Western Reserve University School of Medicine. Through the Office of Diversity, Equity, and Inclusive Excellence, they strive to promote a community where everyone can reach their full potential. Blanton, can you talk to us a little bit about how you are focusing on developing the pathway of future diverse biomedical and physician scientists?
Sure. Thank you, Valerie, for the question. And I'm also delighted to be a part of this a very esteemed panel and to really engage in what is a really important societal topics. So like Celina, I made my way into DEI in part as a basic scientist and as a professor here at Case Western, who's really have a lived experience and a priority on and trying to engage and recruit more underrepresented, marginalized individuals into STEM. So pathway programs are something that's really near and dear to my heart. So as an academic institution, right, our primary mission is to really educate, train, and to generate new knowledge. And I would like to just start by pointing out that, building cultures of inclusive excellence where everyone can reach their full potential is a priority at the highest levels here at CWRU. So in terms of pathway programs specifically, we at the institution, we really, try and span the gamut of pathway programs where we start as early as middle school and go over into developing programs and innovative ways of attracting and recruiting faculty as well. So a couple of examples, the Provost Scholars Program, which is a program that is a partnership between the university and East Cleveland schools, and it's really designed to attract and to engage middle school and high school students from East Cleveland to give them ways of expanding their creativity and critical thinking skills, strengthen their study habits, improve interpersonal proficiencies, and also start to engage with faculty and staff, and some students who can serve as mentors for them here at the institution. A related program to the Provost Scholars Program is the Emerging Scholars Program. And that program is really dedicated to attracting and making sure that students from the Cleveland schools who have matriculated into Case Western as freshmen, that they're provided with the resources, mentoring teams, networks, and a summer bridge program to make sure that their time here is successful. And that program itself is remarkably successful, I would also add. Just to give you a couple more flavors of some of the projects that I'm working on in my role as Vice Dean of DEI and School of Medicine, is to develop programs such that we can recruit, attract, and retain underrepresented and marginalized faculty within our basic science ranks. And so one of the programs that I'm working on, I'm particularly excited about, is a program that is called TRAIN. And that's an acronym, and that stands for Targeted Recruitment to Achieve an Inclusively Excellent Community Network. And that program has several different components that's designed to go out and identify talent, to make sure that that talent will be attracted not only to the institution, but also to the city, and to then retain that talent once we have them here as well. So really excited about pathway programs, and I think it's they're very much in line with the topic of today. So thank you.
Oh, that's great. Thank you. And when we think about an educational institution, it's a little bit different than some of the other, workplaces we've talked about today. Can you think of an example of something where health equity in the workplace would come into play at an educational institution? Perhaps there's a policy that benefits both students and employees, or any thoughts on that?
Yeah, sure. Thanks again for the question. And I do want to just make reference to Gerald's comments earlier about the 15 internal actionable strategies, because I think many of those are agnostic to the organization, right? And so to start, we have a comprehensive benefits and wellness program, right, that our employees have access to. We prioritize wellness, stress management, training, nutrition, weight management, and community well-being. I'll give you a pretty exciting example of something that came out of the pandemic. The institution became a vaccine distribution site for the COVID vaccine. And as a result of that, we were able to really ensure that a large number of faculty, staff, and students were vaccinated, as well as many of our members of our surrounding community. So that's one thing that I think we're particularly excited about, that we're able to leverage resources and provide that service. As it relates to climate and culture, we are very much engaged in ensuring that we offer unconscious bias training. All of our search committees must have representation from diverse groups, including women. They must go through unconscious bias training. We've also started to include diversity statements being requested in our application packages for faculty positions, and those are quite insightful. The information that you can learn from those type of activities. In addition to that, as it relates to the hiring process and recruiting, we're also trying to be more reflective in our seminar series. So we have a seminar series that we started that's known as Virtual Inclusive Talks and Lecture Series, or VITALS. And that seminar series brings in underrepresented, marginalized individuals to really talk about topics related to health disparities, health equity, as well as infant mortality. And so those are just, again, a couple of examples of some of the activities that we're involved in here at the School of Medicine at Case Western Reserve.
Those are some great examples. Thank you for sharing. And now, rounding out our panel, I'm so excited to come to Lora Lewis. Lora is the Vice President of Human Resources and People Operations at Kinetico Incorporated. We've heard from leaders across our healthcare organizations today, but you join us from a corporation and one with a mix of employees, also including manufacturing employees. So for those that don't know, Kinetico pioneered the development of non-electric, fully automatic water treatment systems. And in the many years since their founding, they've grown into a global company with independent Kinetico water experts and international distributors serving more than 100 countries. They offer complete water systems that deliver high quality water for general use and drinking. So welcome, Lora. Can you share an example? Yes. Can you share something that your company has done to value health equity in your?
Yep, absolutely. So, and thank you for the plug, by the way. Our company, along with, again, just wanting to provide, healthy water for all. We do a lot of charity work in that regard. But also just to say, as a very heavily focused manufacturing company, one thing that has been a constant is our focus on developing our wellness program. And, through the program, we've tried to gain insight from our employees and also learn from the insight how we could better serve them and promote, one of our views is like, if we can prevent one cancer or, one chronic illness or, we would feel that the program, was worthy. But so through the program and using the program as a vehicle, we've done a lot of things. We've managed health costs. We've tried to reduce the cost of healthcare for our employees, including not just what they pay for the insurance, keeping that at a minimum, but also, the co-pays and the deductibles. We've instituted health risk assessments, again, trying to get that early, diagnosis or symptom identified. We do biometric screening every year. And then, again, our wellness program is just a very full program. But having said that and having done all of these things, we still felt there was just not, there's just a little bit of a lag in terms of people really being proactive in, seeking out medical treatment when they should and needed it. And what we, through surveys, what we became aware of was that because we had our time off all our time off isn't pooled in a bucket called PTO, and maybe many of your different organizations utilize that as well. But whether you needed the day off for something to visit a child's school or your own health or your vacation, it all came from the same bucket. And what we found employees were doing was pooling that time. It's like if I have a cough or a cold, I'm just going to go to work because I want to save that day for time off for my vacation. And so what we did is we gave them an additional 5 days a year. And again, this is the first year we're trying this and we're seeing some success so that employees could use that time, whether it be for, mental health, attending a child, program at school, visiting a doctor with a child, or their own health, or, and again, seeking out preventive testing and treatment. So we're hoping, and again, at the end of the year, we'll evaluate that, but we're hoping that we see that more employees have engaged in those activities which improve their health and their mental health and that of their families. So that's just one thing that we've done. And again, knocking on wood, hoping we see some positive results.
Yeah, no, that's great to hear. I think it was a nice change. And I know you have a lot of locations. I know there's a large employee base you have in Georgia, very diverse workforce there. Maybe thinking about that location, how have you proactively supported the employee base or any examples there?
Yeah, absolutely. So in Georgia, we acquired that facility approximately 5 years ago. And what we found when we acquired the organization was that there was very little participation in our health program. And, and again, we brought, one thing that we did bring to the table was a very more robust program for the employees. But, sort of notwithstanding that, the diversity in the organization there, probably 80% of the population was Hispanic or Vietnamese. So those were kind of our two diverse cultures that we had there. And what we recognized is, you couldn't just go to that employee base with a pamphlet or an English spoken, description of what the benefits were, because it would not be meaningful for them. So what we did is we hired, and we continue to hire throughout the year, interpreters, so that as we're sharing nuances or changes in the benefits, or trying to convey just how do you utilize these benefits, we have interpreters who can be utilized so that employees have the full understanding. And as a result, and again, tackling the cost issue for them, but also the understanding for them in terms of what these benefits are, we've seen, our participation is almost 100%. So we're happy about that. And then, like at our other locations, we also have instituted this wellness program where we just encourage, employees. And again, being in a manufacturing setting, you get a break, but maybe you don't get a chance to go outside, or so we've really encouraged them to, like in Georgia, they actually take a break and they all literally go outside and they take a walk for 30 minutes. So, they're getting outside, they're enjoying some, esprit de corps with their colleagues. And just hoping that all, bundles up and produces some good. So.
That's great. Thank you, Lora. And I'd like to just come back now to Gerald. And, we know that the American Heart Association did define racism as one of the social determinants of health. Can you speak to any challenges that the American Heart Association faced when we thought about, adopting an anti-racist workplace or anti-racist policies?
Yeah, Valerie, thank you for that. Maybe firstly, though, I'd like to appreciate the other panelists. I'm learning a lot from you, Lora and Celina and Blanton and Mouris and Kelley. So I just want to let you all know that I appreciate all of you and the wisdom that you're sharing, and couldn't agree more with what you all are saying. But Valerie, to your specific question, the AHA, like many other organizations, has always been led by science. And we issued a presidential advisory on structural racism that essentially talked about the importance of addressing systemic and structural racism as a must to address the social determinants of health. And so much so that if you're interested in addressing health equity, you won't be successful unless you address the barriers related to social determinants of health and inclusive of structural racism. And so as part of that, and again, being science-driven, the first question was, wow, how do we communicate this across the organization? And like the rest of society, our organization is made up of folks that understand it and embrace it. And then there are some that really didn't understand it and were really trying to work through how to embrace it, let alone how to apply it to their jobs. And then there were some folks, just like the rest of society, that doesn't see this as an important issue. And so we had to wrestle with all of those truths, all of them incredibly important. And so how did we talk about it? We spend, and I say spend because we're still spending a lot of time thinking about how do we provide tools, how do we provide safe spaces. We have one platform called Courageous Conversations that we have every week in our organization. And it's an opportunity to talk about all things AHA mission, including what it means to be a champion for health equity. And if you think about being a champion, it also means, removing barriers. It also means going there when other people don't. And so how do you help the organization learn how to go there? How do you help the organization evolve its language so that we're using the appropriate language in the appropriate settings. And so we created tools like a language guide to help the organization think about how to better say some of these things. We also spent time talking to volunteers and donors. And we also recognize that helping them understand that this isn't the AHA saying that this is important. What we're always saying is that the science is showing that when you think about the lack of, and I'll give you a couple of examples. If you think about the lack of diversity in some of the medical institutions that make decisions on training or protocols, it means that you don't have the broadest sense of thinking when you roll out that training, and it may unintentionally exclude some folks. If you think about technology and how the lack of representation of diversity has meant that some of the technology that's been created, and I'll use the example of the pulse oximeter, which reads the oxygen levels in people. Well, because of the lack of representation of diversity, some of the equipment, some of the early equipment didn't account for the darkest of skin. And so there was inaccurate readings on people's health. So those are systemic things. And what the AHA was clear about is we're not talking about individuals being racist. We're talking about systems and practices and social norms that when worked together, make it really difficult for everyone to live a longer, healthier life. And so those are some of the things that we're spending time on. We're constantly training our staff on different things. Right now, we're spending time on microaggressions and add the importance of allyship. And we will continue to look for best practices to do it. And then we also recognize that we're probably going to lose some people that were ardent AHA supporters, because not everybody believes that structural racism or addressing health equity and removing these barriers are within the AHA's wheelhouse. We recognize that. So our hope is that for the people that we lose, we're also excited about the people who will be bringing on that didn't know we were here and are embracing the fact that we were here. So we're on this journey, we're learning, we're growing, and being able to learn from great folks like this panel is going to be incredibly helpful to us.
Thank you, Gerald. Now, I know we're getting close to the end of our time, so I did want to thank those of you that submitted questions as part of the registration process for today. We were able to get to most of your questions through our panel already, so thank you for that audience participation. I do recognize there's a couple more questions that have come through the chat that we just may not get to today, but we assure you we will follow up via email. And it sounds like this is an important conversation. We may just be able to keep going here in Cleveland. So thank you for helping us get it started today. We will follow up, like I said, with anybody who has an outstanding question in the chat. Again, as a reminder, we'll be supplying the slides and a link to today's recording, but I'm going to ask Kelley if she would mind just sort of closing us out today. Thank you.
Thank you, Val. Sure thing. And again, I just want to thank the fellow speakers today. They all did a wonderful job. And I want to thank all of you for taking the time to be here and for really helping us build a culture of wellness and equity in the workplace. And I am confident that together we're building a healthier Cleveland. In terms of the materials referenced today, along with the recording, they'll be shared via email. The list of actionable strategies really may be a great place to start if you're looking at making changes in your own workplace. And as a reminder, here are a few takeaways from today. Working towards health equity in the workplace is the right thing to do. Healthy employees are more productive, as we know, and healthcare costs are reduced as a result. The American Heart Association has numerous ways to engage your workforce in a fun and meaningful way, and one of those being formed employee teams of the walkers for the Greater Cleveland Heart Walk coming up this September. I know I've participated for a number of years and certainly is a great cause. And this has really been a key employee morale building strategy for us here at the clinic, and I know for some others on the call as well. We encourage you to find any of the ways that interest you to become involved and to get started on your journey to better health equity at work. Please reach out to the American Heart Association team if you have any questions or if you'd like to learn more on any of the topics that were mentioned today. Take good care and stay healthy.
Thank you. Bye-bye.
Bye-bye.